When I finally arrived at the psychologist's office, I was told to sit down and wait for 5 minutes. It felt like forever. Is there a way to feel better again? Will I be laughed at? Maybe he will think I'm weak. What if he tells me to just get over it? I wanted to just get up and leave. When I finally sat down in his office, it all started to come out. I told him how we had started to experience financial troubles after buying our new apartment, how renovations went on for over a year, with people constantly coming and going, and how all our stuff was in boxes to keep the dust out. My company was having difficulties and they started letting people go. I started to feel pressured to perform in order to keep my position, and at the same time, the feeling of not being good enough became stronger. Then things got better. My company did well and our apartment was finished, but I was still feeling sad and exhausted. It was like life had lost its color, like there was nothing in life that made me happy. Even things I used to enjoy, I stopped doing, and I felt guilty for not being there for my friends. After I told my story, the psychologist started to explain how depression develops and the difference between normal sadness and depression. It is important to remember that feelings of depression are normal emotions, much like feeling sad, upset, anxious, happy, and excited. It is when the feelings of sadness and depression won't go away and start to get in the way of the life you want to live that they become problematic. The criteria for a diagnosis of depression includes feeling sad for more days than not over a period lasting more than 2 weeks. Other symptoms include changes in appetite, loss of energy, changes in sleeping patterns, thoughts and feelings of guilt and worthlessness, as well as difficulty concentrating. The symptoms of depression vary from person to person. Some people start eating more than they usually do, while others lose their appetite. Some people start sleeping more than 15 hours a day and still feel exhausted and tired. Others have difficulty getting any sleep at all. Most people experience their mind racing, often without being able to slow it down, and some people even have thoughts of suicide. Even though it can be hard to talk about these thoughts, it is really important to talk to someone about them, and that we can put plans into place to keep you safe. We talked about the difference between worry, which is focused on the future, and rumination, which is focused on analyzing past events. It was hard to accept that a lot of the symptoms we talked about applied to me, but at the same time, it was good to hear that my feelings were normal, and also that there was a way out of this cycle of depression. In this treatment, you will learn about cognitive behavioral therapy, which focuses on the here and now, the behavioral patterns of depression, and how the mind and body are affected by them. You will learn about strategies to challenge and reduce the ongoing stream of thoughts, how to calm down your nervous system so you can start to get back to how you felt before this stressful period in your life. Finally, he gave me materials to take home to read and some questionnaires to fill out. He told me this was important to map out my symptoms so we could create a sound treatment plan. We also talked about medication as a possibility, but that we would look at that further down the line. It felt good to have talked about it, and I was hopeful that there was a way out.